Welcome back. So have you or do you suffer from heartburn, or do you have a sore throat? If so, GERD, also known as acid reflux disease, could be the cause.
Yeah, that's right. But Dr. Ali Lankarani is a physician at the Borland Groover Clinic, and welcome to the show today. We appreciate your time and you joining us today. So tell us, what is GERD exactly, and how can that sort of impact our lives?
Sure. GERD is a very common disorder that causes heartburn. Usually 1 in 2 Americans at least once a month get the heartburn feeling. It's any symptom that is caused by regurgitation or reflux of gastric content to the esophagus. And we care about this because not only this can be uncomfortable for the patient and cause symptoms, but also can, as long-term, it can cause us other problems that we care about.
Yeah, let's specifically get into those symptoms if someone might be watching right now. What might they be experiencing that would lead them to believe that they have GERD?
Sure. The first and most common symptom that usually people have is heartburn, and that's the sour sensation that starts from top of the stomach and goes throughout in your chest. The other symptoms that people usually do not associate with GERD, some of them are chest pain. We see very frequently in hospitals that people come and they say, oh, I'm having a heart attack. And the cardiologists do their workup and they don't find any problem. And then we see that they have lots of acid reflux. Now, there are some symptoms that are not really related to GI tract. For example, hoarseness of the voice, uncontrollable asthma, or continuous aspiration causing a problem with breathing are some of the symptoms that we also see associated with GERD or acid reflux.
So you say it's very common. So here's the question. If it's left untreated, because we think it's so common, just something that we should accept as part of our lifestyle, what are some of the sort of longer term complications of it going untreated?
Sure. Besides the symptoms and being uncomfortable for the patients, if you leave acid reflux untreated, it can cause inflammation and irritation of the lining inside your esophagus, which is called esophagitis. If esophagitis is left untreated, it can cause stricture, meaning narrowing, or also the skin inside the esophagus can change to a precancerous condition called Barrett's esophagus. Now, Barrett's esophagus unfortunately does not have any sign or symptoms, and usually the only sign that people have is the heartburn.
And then what are some of the treatment options then if someone is diagnosed as having GERD and they come in and they see you? What can they expect as far as the treatment is concerned?
Absolutely. That's a very good question. And usually we start with lifestyle modifications. Lifestyle modifications usually include not eating or drinking before going to bed, losing weight, bringing up the head of the bed. But I have to tell you, unfortunately, the lifestyle modifications do not work in most of the cases, and the most effective lifestyle change is weight loss, which at least I know personally how hard it is to achieve. If people cannot get their symptoms controlled with lifestyle changes, we go to medications. And there is a very good and effective medication, subgroup of medications called PPIs. Those are proton pump inhibitors, and they block the secretion of acid, so does not really treat the problem, underlying problem, which is malfunction of the valve between the stomach and esophagus, but at least takes away the acid, so when it comes up, the gastric content comes up to the esophagus, it doesn't burn or be as patient is not as symptomatic. Now, until fairly recently, we did not have any other treatment for patients that did not respond to the PPIs or medications unless sending them to surgery. And unfortunately, surgery is invasive and has some complications. But very recently, I'm proud to introduce that here at Borland Groover Clinic. We do have a new treatment option, which you can see on the screen. It's called MUSE procedure. And what it does is that basically the same as surgery, brings the lining of the stomach around the esophagus and creates a new valve and augment the function of that valve. This procedure has been done in a few centers only in the country, and we are actually the third center bringing this to our patients, and hopefully we can fill that treatment gap that exists between the medical therapy and the surgery that's currently available.
All right. Well, thank you for that.
Absolutely.
Yeah, thanks so much. We'd also like to thank the Borland Groover Clinic for sponsoring this segment. You can learn more on borlandgroover.com. You can also give them a call at 904-398-7205.